All right, hey everybody, it's me, Steven, and I'm here with my good friend, Dr. Rob Nichols. And Rob's been at Cedar Lane a lot longer than I have been, and also knows a lot more about how bodies work than I do, which I think is fairly obvious to most people. But anyway, so Rob, you want to tell everybody what you do here in town?
I'm an internal medicine physician, work in the same practice as Dr. Bills. Been here for 11 years now.
All right, and you've been you were at Cedar Lane when it was Bel Air. I guess how long you been here? Like
Since I was in second grade.
Second grade. Okay, so that's been a minute. So Rob's a great beloved part of our church, also a physician here in town. We just want to talk a little bit about the coronavirus stuff because I know a lot of people have questions about that. I bet you guys are getting tons of
Every single patient.
questions about that. Yeah, people that come in like they've hurt their toe. What?
Mm-hmm.
Yeah. Well. It is something that we want to take seriously. There's some, obviously, some real concern in our community for it. At the same time, we want to find that balance of not overreacting at the same space too.
Definitely.
Okay, so let's talk a little bit about. First of all, just so everybody knows, at this point right now, we're not canceling services or anything like that. We are watching the situation. We want to see how it develops here in our community and in Tullahoma. And you know, if there comes a time where that's appropriate, then we'll look into that. But for now, talk to us about there still may be some group of people that it might be better for them to, take a week off and skip. I mean, what do you think about that?
So the coronavirus, as we know it right now, is mainly a danger for people that are over the age of 65 and have other medical problems like COPD or heart disease or have immune issues and maybe on chemotherapy or along those lines. That group of people needs to be very cautious in being in large groups of people. They probably need to avoid giving a lot of hugs, giving handshakes. They do need to wash their hands frequently, and that group of patients probably really needs to think long and hard about coming to a public service.
Yeah, and that's fine, and we're going to do our best to have streaming up on Facebook this next week and have some ways for you to participate in our community, even if you choose not to be here. We want you to, if that's the thing that you need to do to be safe, we want you to feel comfortable doing that. And for those of us that are here, we need to be more respectful, make sure, probably need to limit going in for that aggressive handshake and hug.
Mm-hmm.
Everybody, the washing your hands stuff, that just needs to be, everybody needs to do that all the time.
Always.
But certainly in the sickness, at this point, we really need to be pretty conspicuous about that, or conscientious about that, and make sure that we're loving. That's kind of a way of, we talk about loving each other a lot right now in this study on John, and that's a very practical way. Sometimes maybe the best way to love somebody isn't washing their feet; it's washing your hands.
Oh,
you like
correct.
that?
Very correct.
You like that, guys? Yeah, that was good. Okay, well, so what else do you think in terms of obviously there's reason to be concerned, but how are you kind of approaching that right now in terms of your own?
So for most people, this illness is likely at worst going to be a mild cold, especially for younger people.
In the way it affects, even if you get it, that's the way it's, yeah.
It would be, a cold is about as bad as it's going to be. And in that group of people, staying home while you're sick is very important to limit the other people getting it from you.
How long we should stay home?
They are currently recommending 14 days.
Okay.
So if you have a high fever, shortness of breath, and cough, the current recommendation from the Centers for Disease Control is to self-quarantine for 14 days. You don't necessarily have to go be tested or seen by your doctor.
Okay.
If your symptoms are mild, they just recommend staying home. If you do have significant symptoms, though, we would recommend you contact your doctor. Most people under the age of 65, unless you have some of those other chronic conditions, will fall into that category. In fact, around 80% of people who have had coronavirus had very mild symptoms and had no long-term issues with it. So for that group of people, staying home if you are sick is the most important.
Okay, all right. And again, this is one of those things that goes both ways. So whether, if you're sick, don't come. If you're healthy and you're in one of those vulnerability groups, then maybe staying home for a little bit is the right course of action too. And then I guess one other thing I want to say is that we have here in our community, we know that Life Care and NHC, I don't know if other facilities have said no visitors for right now. Is that?
As far as I'm aware of today,
Uh-huh.
all of the nursing homes and assisted living facilities are requesting no visitors.
So something that you might really want to think about doing is if you're just keep in mind that we have some people from our church who are in long-term care, and they could probably they're not able to have visitors like they normally would. Be a good idea to send a card to somebody.
Send a card or communicate via email if they have that ability. But
Yeah,
yeah,
email or text or something like that. Yeah.
Staying away from face-to-face visits right now is probably best for that group because they are the most vulnerable.
Yeah, yeah. So just thinking about that, there are some folks who. People who are already isolated and already have some level of having to be distant from other people. This is the kind of thing socially that makes it even harder for them to get some of that social contact. So maybe being attentive to that, reaching out in other ways, sending somebody that text or a picture or something like that, let them know you're thinking about them. Probably a really good thing you can do just practically.
I agree.
For now. Okay, all right. Well, stay tuned. Like I said, if there's anything that we decide, as our church decides that if we come to a point where we need to make some other changes, then we'll certainly let you guys know. We'll be aware. And besides that, we just want to make sure and be respectful of each other. Take care of each other as well as we can, and just practice that good hygiene. Maybe skip some of the handshakes and big bear hugs. Definitely, everybody likes to cough into their sleeve, but then if you take that sleeve and then go hug somebody right in the face, then that's,
Not going to work too
it's
well.
still there, right? Yeah,
Exactly.
yeah, it's not the sleeve. Is this part of your arm a magic disinfectant?
No, it is not.
It's not. So the germs are still there.
They're still there.
Okay. Well, I guess that's good to know.
That's good to know.
Well, Rob, appreciate your ministry of health, here in this community, and appreciate the way you take care of people, and also appreciate you talking to us about what we can do to take care of each other here in our church and our community. Okay, thanks guys. Grace and peace.